Sometimes, danger hides in plain sight. An ordinary meal, a birthday party, a child's laughter. And then, in a heartbeat, everything changes. Anaphylaxis doesn't wait for awareness. It exposes the blind spots that can cost a life.
Well, anaphylaxis in simple terms is explained as the most dramatic, the biggest and the most terrifying allergic reaction you can experience. It can start in a few moments and it can go to a level that is enough to kill a person.
The reactions involve urticaria on the skin, that means wheals on the skin, and reddening and pruritus. It also involves nausea and abdominal pain, and circulatory problems or respiratory problems with dyspnea.
So I was on holiday in Italy with my friends. We were out in the evening, had dinner, and then after dinner, where I was eating obviously gluten, walked to a bar, and there, when we arrived there, I started feeling the symptoms, which I didn't know what it was at the time. And then I lost my eyesight. I couldn't see anything and I couldn't hear anything.
The health system needs to understand that anaphylaxis can happen at any age, that it is can be a quite severe reaction, that the patient can die, and that they need to give the tools for diagnosis and for treatment, and that the auto-injector needs to be available worldwide, probably in the future then intranasal adrenaline.
One of the challenges we face with how we understand anaphylaxis is that we really do not understand the immune pathophysiological mechanisms of anaphylaxis, because this will make it much easier for us to develop novel therapeutics, prevent the onset of severe reaction that one we see in our patients. Well, research is fundamental to support patient management, because the research we do is then translated from what our physician colleagues are able to see patients and really then treat them. But what's really important is how we get there, and what we need is have substantial funding which can support all the research that we do, immunological research, translational research.
I think that we have brought together, but together means discussing together, patients, family of patients, researchers, basic scientists, clinicians, nurses, absolutely all the people that have something to say about the management of anaphylaxis.
We should not tolerate any anaphylaxis. We should not tolerate any deaths of a child, of a patient, either in a school, either in a hospital setting because of medication, even with venoms. So, vision zero towards anaphylaxis.
Knowledge doesn't end the fear, but it teaches us its language. The more we uncover, the more we realize how much still lies beyond explanation, waiting for us to listen, to study, to care.